The first test we're going to do, the special test, is to assess the rotator cuff. The near test is performed by putting your hand on the scapula to stabilize it, and then the shoulders brought into straight forward flexion in order to see if by bringing the humerus into flexion maximally, if it causes any pinching in the area of the anterior humerus against the anterior acromion. If there's a spur in the anterior acromion, that can oftentimes lead to pinching of the rotator cuff in that area. The next test for rotator cuff is much like it. It is called the Hawkins test. And for this test, we bring the arm into forward flexion to 90 degrees and then internally rotate the arm maximally. And by doing that, it brings the humerus up in association with the anterior acromion, and then by rotating it inward, or internally rotating, it brings a greater tuberosity also into that anterior area, impinging the rotator cuff if there is a problem with it. The next test we'd like to talk about has to do with checking the integrity of the subscapularis, and that is performed by what's called the lift-off test. The arm is brought behind, and then we ask them to lift their hand off their back. Can you push your hand back? And a lot of people are unable to do that, so an easier way to perform that test is not to lift off, but actually have them push their hand against their abdomen as you try to bring it back. So resist my pulling. And what that shows us is that he has good internal rotation strength of the humerus, indicating the subscapularis is intact. Now we'll do a couple tests for the biceps tendon. The first is called Bjerkeson's test, where the hand is started in pronation so that the biceps is in maximal stretch, and then you ask the examinee to bring their hand, the elbow into flexion and supinate at the same time. So I'm going to resist that and palpate the biceps, long head of the biceps, with my thumb as we do that maneuver. So go ahead and, as if you're picking an apple and bring it up to your mouth, go ahead and do that maneuver for me. I resist with my right hand, palpate with my left. If there's a problem with biceps tendonitis, approximately that should cause pain. The next test we'd like to go over is called Speed's test, and the way that is performed is to bring the arm straight out in front of the body, palm is up, and you ask them to hold that up. If there is a problem with the way the biceps is attaching to the biceps anchor on the superior labrum area, in other words a slap lesion, superior labrum anterior to posterior tear, that will cause pain, particularly if the examiner pushes down on this arm. It puts a lot of tension on the long head of the biceps. It will be quite painful for the examinee. Next, we'd like to do some tests for instability. The sulcus sign is a test that can be done in order to try to find out if there is multidirectional instability of the shoulder. We bring the arm into a relaxed position. I stabilize the opposite shoulder and I pull down and check to see if there is any sign of a sulcus, which may occur because of laxity in the ligaments, particularly the inferior glenohumeral ligament, which may result in laxity as you pull down on the shoulder.